The nice thing about the center is we actually engage the community as part of its own safety net, in the sense that we bring people in from the outside community, we train them, they learn how to handle our calls that we get, whether they're crisis calls, suicide calls, or people who just need some empathic listening. The Crisis Center was actually founded in 1970 by Dr. Richard Farmer and Dr. Alan Battle. Dr. Farmer had a patient who was hearing persecutory voices, and he eventually lost hope and ended his life. Dr. Battle co-founded it with him, and so we've been around now. We're coming up on our 40th anniversary, and we're very excited about that. We're also a newly independent agency. For about 15 years, we were under the umbrella of Family Services of the Mid-South. We did that in order to get United Way funding. However, Family Services, due to bad economic times, had to close its doors in October, and so we're a newly independent. We are a United Way agency, and we're very proud of that. We're also very grateful to the University of Tennessee Health Science Center that has provided us with both office spaces, a call center, and a separate training facility. The other thing about the center that I think is very important in terms of our mission in the community is the fact that we're often a point of entry for people who may not otherwise access services. There are a lot of things that can act as a barrier to somebody actually getting the services they need. Sometimes that is shame, sometimes it is fear, sometimes it is stigma. The nice thing about the center is it's a place that people can turn to, which is confidential and anonymous. And so what ends up happening is they're able to finally talk about that difficult issue, whatever it is, whether it's a new HIV diagnosis, whether it's a mental health issue, whether it's struggling with suicidal feelings, whatever that situation is that may be difficult for them to talk about, they can turn to us, and then we can use that as well as an opportunity to educate and destigmatize and encourage them to access the services they need.